my introduction already. Sherry Rogers is a registered practical nurse at the Regional Health Center. She's going to talk a bit about the kind of diseases that the nurses and staff at the health center are dealing with.
Hi, my name is Sherry Rogers. I'm a registered practical nurse. I work at Notre Dame, and I've had 17 years experience. In hospitals, we're having patients admitted have a higher incidence of VRE and MRSA in our hospitals. The current use of antibiotics is certainly have made it difficult for us to deal with these infections. Thorough cleaning procedures, staff precautions, hand hygiene are some of our methods of fighting these infections. Our patients that are being admitted for illness and elective procedures have a higher risk of contracting thorough procedures to keep our rooms clean and keep our patients safe. Trained professional and diligent cleaning is how we strive to minimize the superbugs.
Steve Fournier works as a cleaner at the Montgomery Regional Health Center. He's going to talk about what's involved in cleaning a room that's been occupied by a patient who's had one of these superbugs to make the room safe for the next patient.
I'm Stephen Fournier. I work in environmental services for 21 years. When we're dealing with isolations, the ideal thing is when we put all this stuff on. Put the gown up, gloves, masks for isolation. Demonstrate how to put this stuff on. Paper suit. Gloves on. Put two pairs on. When you're taking your gown and things off, you can take your other pair off. You're not touching any part of it. Over top of your gown. Sure you're covered. First of all, you're going to have to clean everything in the room that the patient would be touching. If there's curtains, you take the curtains down. You start from the far end and you work your way out to the door. So you have a cloth here. Start at the back part of the room. Clean everything that the patient will be touching. You touch the light, the cord, the wall. Always do it the least amount. IV pole, all this stuff. Bedside table, take all the stuff off the bed, wash the bed down, clean things as you go out of the room, and then you have to wait for it to dry for about 10 minutes, and you do it again. So any isolation or say C. diff, everything has to be done twice. So the whole clean, and you do it again, start from the far end. And then you'd wash the floor from your mop, start at the back, move the items, the floor, under, corners, whole thing, work your way out, and you dispose of your items. Have isolation in the cart beside you, with a bag to throw your things into. And you take your items off. Clean gloves. In. Gloves are still in. Throw them off. Take away your items.
Thanks, Sherry. So, I mean, as staff who work in Ontario hospitals, we feel an obligation to speak out, because a lot of people are bringing their parents and their loved ones to our facilities, and they don't, they're not fully aware that in these hospitals, because of overcrowding, because of the overuse of antibiotics, because of the prevalence of these drug-resistant diseases, their loved ones are vulnerable to becoming ill and to dying. And the fact that between 3,200 and 5,000 people will come into our hospitals in Ontario this year and will die from a disease that they did not have when they arrived is very tragic, but it's also tragic because many of these deaths are preventable. So we're launching this tour of Northern Ontario, and very excited to be going to places like Hearst, Hornpain, Little Current, Manitoulin Island, New Lisker, many communities, and we're going to be calling on the Ontario government to require hospitals to report deaths from these superbugs. We're going to be calling on them not to close the 5,000 hospital beds that are slated for closure, but in fact to add beds to the system so that we can ease the overcrowding in our hospitals. And we're asking for more resources be put into cleaning and infection control. And that really is what we'll be doing over the course of the spring. And I'm proud to do it, and hope it'll have an impact. So I'm sure Sherry and Steve would be happy to answer any questions.
What I'd like, if I could, is to get a picture of the three of you together, with this set, and the shots, and then talk to you about the campaign and what's involved in it. Just get a couple quick shots.